very much, Dr. Ajimambedu, and a very good morning to all our participants in this workshop. Like you rightly highlighted, this year's Psychology Week celebration, we have actually devoted today to address some mental health hazards that are inherent in the media space. And so I'll be looking at journalism, work, and then mental health hazards. My presentation is likely to overlap a little bit with that of Dr. Atta, but I'll leave certain things out so that he will be able to take them up from there. But in terms of an overview, I just want to briefly look at the current state of mental health, of course, in journalism. What is the reality of journalism today? What are some of the psychological hazards in journalism? In fact, what reporting scenarios are we likely to encounter mental health issues? And then highlight a few mitigating strategies, and then what the recommended benchmarks are, especially for media houses. So by way of introduction, you would all agree with me that the field of journalism in Ghana is very, very important. And because, of course, they form the main cornerstone of our democracy, and also the pillar for which society functions. Society functions on, or we thrive on, information. And we get this information actually from the stories that are put out there by our media practitioners. So journalists hold the critical responsibility of informing the public, shaping opinions, and as it were, serving as the fourth estate of the realm, as we all know. So it's a very important profession as far as the Ghanaian democracy, our economy, and in fact, the function of the entire society is concerned. And so you see that a lot of the journalists are performing multifaceted roles, reporting on government actions, reporting on social issues, informing, educating, and even sometimes entertaining their audience. So these are a very important role. And as far as psychology is concerned, these are some of the things that we also need to continue functioning even effectively. But whilst we actually celebrate journalism for its impact and necessity, it is important to highlight that the mental health of journalists is actually a concerning problem. In other words, it has not really been taken seriously. And so the primary aim of this presentation is to try and articulate some of the psychological challenges inherent in journalism, particularly within the Ghanaian context. Because the reason why this is very important is that poor mental health can actually lead to a reduced productivity. It can even lower the quality of work that our journalists produce in terms of the accuracy of the information that they put out there. And they are more likely, if they are not thinking straight, if they are impaired in their thoughts, they are even likely to introduce biases in their reporting. So acknowledging and addressing these issues certainly is going to help to promote a healthier, a well-balanced, and even a more ethical field of journalism in Ghana. And for which reason, we'll say that, yes, this workshop is very, very important. So what is the current state of mental health in journalism in Ghana? Well, many of our media houses in Ghana are yet to introduce formal mental health programs or even stress management protocols in their various operations or institutions and all that. And also, we are living in a country where the stigma attached to mental health issues even make it very difficult for people, including journalists, to even openly discuss their challenges. In recent times, we have heard a couple of journalists who have come out to say that they actually went into depression, and they have given their experiences, what they went through, and the fact that they didn't have anybody to talk to. There was no support system for them. And some were even depressed and were having mental health challenges, but yet they had to come to the studio and just smile at their cameras. So you can see that a lot of them are smiling and laughing outside, but deep within them, they are actually crying and even struggling. Now, recent studies have shown an alarming rate of stress and anxiety among journalists in Ghana, and we can cite that by Solomon and, of course, Ajiman. In fact, in the study by Ajiman, he highlighted that there is a significant impact on the mental well-being of these media practitioners because of the kind of work that they do, because of some of the stories that they cover. And so it is not really difficult at all to highlight that within the media landscape or the media space, stress and anxiety is something that is very, very prevalent. Now, added to these unique stresses is also our own Ghanaian situation or Ghanaian milieu in terms of infrastructural challenges. For example, you have to go to a place to go and cover a story, even our transportation, the traffic that you may have to go through before you get to the event, our digital infrastructure, data issues, stability of the internet. All these things can even make the journalistic practice quite challenging. Then, of course, you can also highlight the pressure to adapt to a rapidly changing digital landscape, where we have so many social media platforms. And then we also have the potential for political intimidation or societal retaliation for critical reporting. So our journalists who are into investigative journalism, who are into critical reporting, trying to uncover, if you like, unscrupulous behavior, you can imagine the kind of intimidation that they go through every day. So these, if you like, issues, or if you like, Ghanaian specific challenges tend to compound the existing global issues like deadline pressures, the always-on culture, and the emotional toll of covering traumatic events, and tend to make the work of the reporter or the journalist very, very stressful. So what is the reality of journalism today? We can say that the nature of journalism has really undergone a seismic shift. And this is because journalists today have to adapt to an ever-changing landscape dominated by social media, whether it is Twitter or social WhatsApp, Facebook, and what have you. And there is that 24-hour news cycle. So almost every minute, every second, every hour, something has to go out. So, and of course, our increasingly complex political and social issues. So in Ghana, for example, throughout the day, apart from all the other entertainment or educative news, we'll hear a lot of political issues. Of course, because it concerns each one of us. There are also social issues, Galamsey, LGBT, and what have you. So this has actually made the media landscape very, very, very aggressive. In Ghana, we also have a very young and mobile savvy population who are keen on real-time updates, not only on politics, not only on elections, sometimes even on entertainment. So they are always glued to their social media, they are listening to radio, television, and they want to hear something new. So you can imagine if you're a media house and you're always providing already known information, nothing new. Nobody really patronizes you. So that really adds to the pressure. So journalists today, they always have to be on, ready to report at a moment's notice, and perpetually be connected to multiple information sources. So we can say that the constant urgency to break the news first tend to place a heavy psychological burden on our media personnel. But regrettably, this is an aspect that a lot of the media houses, especially because they are operating on a very tight budget or they have a skeleton crew, they seldomly address properly. And that is why we are taking it upon ourselves to highlight the importance of these issues. So let's look at a couple of the issues that actually are associated with journalism today. And one of them, even though I've highlighted, is the pressure to meet deadlines and stay ahead. So in this situation, deadlines, anytime we talk about deadlines, deadline is not something new to journalism. It has always been there, but it has taken a different dimension in recent, in fact, it has evolved significantly because of the shift from periodic to continuous news cycle. So now 6, 9, 10, there's always news bulletin before even 12. Normally it used to be 6, then 12, then perhaps another 6 or maybe 3. But now there's almost news bulletins across, even if not on the main traditional stations, at least on social media, people are being updated. And so that window of reporting has drastically shrunk now. So you don't have time. Within the next minute, the next hour, you have to go out there and put out another information. So you see that our journalists are really racing against time constantly, and they are juggling multiple stories within short periods. Now, the consequences of this practice or the nature of their job is twofold. First, the stress of perpetually looming deadlines can lead to acute stress symptoms like insomnia, high blood pressure, and even burnout. And secondly, the quality of the reporting can even suffer due to this persistent rush because you may not even have time to cross-check the information you are going to put out there. And if we don't take care, we are likely to report inaccurate information. We know the consequences, the repercussion of putting something out there which is not accurate. You may lose your followership, your listenership, and even your credibility as a credible media agency. Another aspect we also want to highlight today is the job security and freelance work today. Job security is a significant concern across professions. But I might say that in the realm of journalism, it takes on a unique characteristic. Because in Ghana, where we have media, our media landscape is evolving, job security is even less guaranteed. Many journalists today have to turn to freelance work, where they are juggling with multiple roles to just sustain a living. Now, this lack of job security tends to contribute to chronic stress because they are always concerned, they are worried about their job, whether they are going to be staying on their job for a very long time or they are going to move on. So it puts them in a situation where they are likely to go through chronic stress. And this will not only affect their work as journalists, but also, of course, going to affect their family members too. If you look at freelance journalists, they even face the additional stresses of unstable income, lack of health benefits, and even the absence of a structured social or organizational support system. And sometimes situations like this would even force some journalists to bend the rules and now introduce biases in their reporting. So the lack of job security is very, very serious. And it tends to contribute to chronic stress that really tend to affect these journalists. In fact, today we talk about citizen journalism and blogging, which have also added to the competition and further exacerbating the anxieties related to job security. So when you speak to a lot of the media practitioners, a lot of them actually sometimes are concerned about how much they earn, given the kind of work that they do, sometimes waking up very early to come and then writing news and reporting and all that they go through. And sometimes they bemoan how much they earn going through all this. So job security is really a major problem, which also add to the mental health issues of our journalists. Then I also want to highlight covering sensitive and traumatic stories. Certainly once you are living in a country like Ghana, in Africa, of course, anywhere in the world, and you want to work as a journalist, and once you have human beings, you are always going to see things that are just shocking. And these are emotionally charging things. So the emotional toll of journalism work often goes unacknowledged. Because whether a journalist is reporting a political unrest, a natural disaster, flooding, or some social injustice, like mob injustice, or any human interest stories, galamsey, or pregnant women going through some difficulties, child abuse, LGBT, we should understand that they are often exposed to varying degrees of emotional and sometimes physical trauma. Sometimes you may want, as a journalist, just go there and report what is there. Maybe there's an accident on the road. You are seeing arms and legs and heads everywhere, and you are just covering it. You can't really take yourself out of that situation. Certainly, you feel it. And our social norm within the Ghanaian culture, where we are not provided the space to express our emotion or even seek psychological help, tend to create a certain culture of silence and stoicism, which of course are detrimental to the long-term mental well-being of our journalists. So we don't want our journalists to take for granted that they go there and then they go and report issues of deaths, human interest stories that are emotionally charged. They can really separate themselves from the story and also their emotions. It can be very difficult. You can imagine how some of them are even able to sleep. Sometimes you break a news about corruption, reporting a government official coming up with something, the threats you are receiving. You can imagine your emotions. Some of these journalists will come out and say, oh, I'm fine, I don't fear anything, I'm working for God and country. They can say that openly, but deep within them can tell you that they are going through a lot. So that is the reality of journalism today. And once you go through this kind of work or practice, then there may be a lot of hazards that you are supposed, psychological hazards actually, that you may have to contend with. So what are some of the psychological hazards that we can highlight? The first one we can talk about is stress and burnout. Now, because of the deadlines, you want to cover breaking news, you want to meet deadlines and all that, journalists become overly engaged. So the stress starts because of the over-engagement. They become more reactive in terms of their emotions because, of course, the stories that they are engaged in. And there's always a sense of urgency. And these things tend to have a physical toll. You become tired. Sometimes it can even affect your sleep and anxiety too as well. Now, because of the stress that they tend to go through during the day or during the course of the work, it is likely to then lead to burnout. Because burnout tends to affect the quality of even your productivity or the reports that we put out there. Sometimes I just want to explain the difference between burnout and stress. Actually, stress or burnout is a resulting effect of stress. So when we become too stressed out, we are likely to experience burnout. So in stress, we become overly engaged, but in burnout, we become disengaged. Our emotions become distant and blunt. But when we are under stress, we become more reactive, become more engaged. So when you become burnout or you experience burnout, you actually find it difficult to now even have empathy or feel how others feel, because it has become like something that you are used to, which is actually not supposed to be not supposed to be normal. There's also a sense of helplessness because nothing is changing. The pressure that you are going through, there's no end in sight. So you become helpless. And that is, once you begin to experience a sense of helplessness, then that becomes a state of burnout. You now begin to even lose motivation. So there's a diminished interest in things that you even want to do. And that can lead to a feeling of what? Depression, and have an emotional toll. So while stress may have a physical toll on a journalist, burnout will have an emotional toll, become emotionally drained. And that becomes very, very serious. And so once you are in that situation, you can imagine in terms of your reporting, certainly it can compromise the quality of the work that you put out there. Another hazard that we need to mention is what I will call the vicarious trauma, or if you like, secondary traumatic stress. Journalists who are reporting emotionally charged events or stories are at risk of vicarious trauma. Because if you are the first to respond to scenes of trauma, disaster, and conflict, it is likely to impact your emotion. Now, vicarious trauma can manifest in a way where there is a shift or a change in your worldview as a journalist, affecting your sense of safety. Sometimes even when you're approaching a place where it is even dangerous, you don't even see it. Can even affect your intimacy, especially even with your partner, or even your children, because of some of the emotionally charged things that you've seen. Sometimes you cover certain stories about maybe, let's say, a homicide story or some domestic violence. And then you come back and now you look at your spouse and you are now likely to see him or her in a different way. So vicarious trauma can even impact our ability to engage empathetically, both professionally and personally. So we may even lose our sense of empathy, especially when it comes to certain sensitive issues. I have bemoaned situations where, and I'm sure Dr. Ando will talk about this when he talks about suicide reporting, how sometimes some media reporters or presenters, they are reporting suicide and they make it look like it's a joke, it's a funny story. Meanwhile, they are talking about a very sensitive thing. Sometimes when we are used to some of these emotionally charged things, it can even affect our empathy to the extent that when we are reporting something that it's quite sensitive, we may say it in a way that it might actually affect the sensibilities of others. Another hazard is anxiety disorders. And anxiety disorders emanate from the uncertainty and the high pressure nature of journalism work. Also, the fear of making a mistake, misreporting facts, or even the consequences of exposing uncomfortable truths, threats, intimidations, all of this can lead to chronic anxiety, which can also impair both work performance and the overall quality of life for the journalist or for the media person. In fact, there are enough anecdotal evidence to suggest that anxiety is so pervasive within our media landscape and needs or require urgent attention. Because we see that, we see intimidation, we see threats everywhere. When people are reporting, if you like, truths, uncomfortable ones. If somebody is talking about galamsey or LGBT, sometimes we see the insult. If you go to social media and read comments on certain things that people have just said. You can imagine. There's also the risk of what? Depression. Now, depression among journalists is very, very serious, but it is often overlooked. Why? Because a lot of these journalists are not able to report it. Sometimes we hear about it when they have get over it, but in most cases, we don't even get to know. And this is as a result of the perpetual cycle of stress, the vicarious trauma, the anxiety. So if you constantly go through stress, traumatic events, and anxiety, you're likely to experience depression. Journalists may also experience feelings of hopelessness, decreased energy levels, and even loss of interest in what they do. So we have spoken to some journalists who say that at some point in time, they don't even have interest in even coming to the studio to do what they love to do. But because it's their job, it's part of their job description, they just have to be there and do it. And they just be smiling and laughing and all that, but deep within them, they're really struggling. In fact, there are instances where some journalists are even considered suicide or had some suicidal thoughts. So the lack of emphasis on mental health support in most media organizations even makes dealing with depression even more challenging. And so it remains underreported and it is not properly addressed. The last hazard I'll mention, and you don't want to be surprised about this, is substance abuse. And it's also quite prevalent among our media personnel. Because of the ongoing stress, the anxiety, the emotional toll, to cope with these things, some journalists resort to substance abuse as a form of self-medication. And a lot of them is by drinking alcohol. Now, we live in a country where our culture enables the use of alcohol. So it becomes even problematic to address it or to even see it as substance abuse. Now, substance abuse, even when it has to do with medication, some of these things are not even prescribed. People are taking all kinds of drugs just to be able to move on. In fact, energy drinks, just to be able to stay awake and then get the news out there. And that is quite damaging because it does not only affect your mental health, but your physical health too as well. Because taking in energy drinks or some of these drugs and all that, it goes to impact your cardiovascular system too as well. And virtually, you tend to suffer heart attacks and hypertension. So in what situations are we likely to see mental health, especially when it comes to reporting scenario? Of course, breaking news, whether it's an accident, a pandemic, or maybe a riot or some demonstration, picketing somewhere. Some of these things, they put enormous pressure to report quickly and may put our journalists at a risk of acute stress disorder. Reporting conflicts can also expose journalists to traumatic events, which may lead to PTSD or post-traumatic stress disorder too as well. What about investigative journalism, which is now more or less gaining grounds here in Ghana? In fact, it requires months of hard work to put together that journalistic piece, everything together in the form of documentary and all that. But sometimes too, it can even become a threat to your own life, because if you are going to report about a big man somewhere and all that, then you really need the balls to be able to stand the threats, the intimidation, and that can really affect your night. And that can lead to acute anxiety disorder too. Also, when we have to report on social issues, LGBT is very topical, Galamsey is still topical, child abuse, domestic violence, some of the carnages on our road, accidents, going to see blood, seeing dead bodies. Of course, We cannot go through all these emotionally charging stories and thinking that we'll come out unscathed. No, certainly it's going to impact on us, can affect our sense of empathy, and can even affect our sense of well-being. So reporting galamsey, the retribution that comes with it. And then very soon, as we are going to cover elections, we know that it can have that volatile mix of long hours of work, lack of sleep, and the need for quick turnarounds. So how are we preparing our journalists as the elections period unfolds? So these are certain reporting scenarios that anytime you engage in them, as a journalist, you need to know that it is going to have a toll on you. So you have to put in place certain things that can really help you to keep your senses, especially your mental health. Sometimes we love our job so much, which should be the case, but we should not do that too at the expense of our lives too as well. Our lives are very important. Our health is very important. We need to live to see the impact of our stories. So if we have what we can do to protect ourselves, we want to do so. I know my colleague, Dr. Newman, will highlight a few of this, but I just want to stress, these are just a couple of things that I want to highlight so that as tips, as strategies that we can use to mitigate some of this. Self-care is very important. So even if you have to go out there and be on the go and all that, at least have some fruits, have some water with you. Make sure that you are dieting well. Do some exercise before you go, because all these things can help the body to withstand the stress that it goes through. And please, we have to sleep. Maybe our next psychology week, we'll talk about sleep and mental health for journalists and why we need sleep. Because studies have shown that sleep is nature's best attempt to immortality. So if because of our work we are not sleeping, it is our lifespan that we are reducing. It's our lifespan that we are reducing. And given the pressure in the work of journalists, we are likely to lose sleep. And sleep is such that we cannot make up for it. You cannot lose 4 hours of sleep last night and say that today I'm going to sleep 12 hours or 8 hours to make up. No, it doesn't work that way. The moment we lose an hour of sleep, we get the hit for it. And interestingly, human beings are the only species that tend to defer sleep. It is not natural to nature that people or humans or animals will defer their sleep, but humans will tend to do so. And because nature is not used to that, there's no safety net when we defer or we are not sleeping enough. So please, our journalists, we want to encourage you to take your sleep very seriously. Engage in mindfulness techniques when you have to report certain emotionally charged events. Taking in deep breaths, going through some breathing techniques or exercises are very important. And then seek professional help, maybe through an in-house counseling or even online therapy. Time management is very important. Peer support, community building among yourselves. Sometimes during the day, journalists can meet together, have a certain platform, they discuss their challenges, the issues, the problems they are going through mentally, so that they can actually provide support for each other. But what are the recommended benchmarks and guidelines for media organizations? Well, one of them is that, as I mentioned earlier, a lot of them do not have any mental health policy. So can our media organizations begin to draft some mental health policies and protocols that they can really stick to? For example, every year, every 2 years, all the journalists working in your media houses or in your institution, they go for mental health screening or mental health assessment to see their levels of stress, anxiety, and depression. So that as an institution, you know exactly what support to provide. Contracting EAP programs to support the psychosocial well-being of the employees is also very important. Having a mental health day off work. So mental health day, or some people are off work just to give them the opportunity to refresh and come back. It's also something that maybe media organizations can look at. Ethical guidelines for reporting sensitive issues. And I guess Dr. Ando will highlight this. Training workshops like such as this is very important. So mental health workshops to equip journalists and all media practitioners of what they need to know about their mental health and how they can take care of themselves is also very important. And having in-house counseling sessions, speaking to organizational psychologists to support the psychological well-being of media health, media practitioners is also something that I think should be considered by our media organizations. So to conclude, I must say that all that we have discussed, even though individual journalists also have a part to play in their own self-care, it actually requires a collective action. And so every stakeholder, whether from media house executives to junior reporters, need to play a role in ensuring that the mental health in the journalism landscape is actually protected. So it is important to shift from reactive mental health management to a more proactive. If we take some of these suggestions and these guidelines and benchmarks that I have just preferred, then it can help in the timely identification and intervention for these issues. So I want to conclude by saying that we have to start the conversation within the media fraternity about incorporating best practices, mental health best practices. And also remember that the story that we are putting out there is very, very, very important, very essential. But the storyteller is irreplaceable. So your health is also important. I thank you for your attention.
Thank you very much, Dr. Richmond Akwa-Coleman, for dilating on some of the needs, some of the challenges our media friends and colleagues go through. And I especially like the approach at the individual level, some of the things they can continue to do to promote a healthy mental health and well-being. And also the call for media owners, various employers to actually institute mental health policy to support the well-being of these media practitioners. Yes, it is true. Their work put them at the mercy of emotionally charging experiences. Now more than ever, I think it is very important we give the health of media practitioners and journalists a much needed attention. And when you said that, I just remembered the experiences of people like Kevin Carter of South Africa, and even our own dear brother Komla Jumo, who had to do back-to-back, had to sacrifice a lot of time. At one point, he himself quoted that he needed to welcome a lot of attacks, even within the industry, simply because he wanted to rise up to the occasion. And I think we need to give the health and well-being of media practitioners the attention that it deserves. So we all have learned a thing or two. The employer has gotten his share, and the media practitioners themselves have also gotten their share. And we as practitioners, we will continue to do our part. I love what you said. We need to perhaps consider sleep. And that is something that we consider as we move on into the future. At this point, we want to welcome Dr. Isaac Newman-Arthur, who is a clinical psychologist and also an active practitioner and currently the PRO of the Ghana Psychological Association, to dilate on some strategies that they can employ to be able to stay active as far as their mental health is concerned. So, Dr. Ike Newman-Arthur, please, you have our attention. Kindly unmute. Okay, please unmute and go ahead.
Okay, so thank you very much, Dr. ABC. Thank you for the opportunity. I want to also say thank you to all the people who made time to join us in this session. Thank you, Dr. Akwa-Coleman, for the wonderful presentation. I'm going to continue from where he left off. Please, if you can allow me to, okay, I'm sharing my slides now. Please, can you see my screen? Can you see my slide?
Yes, we do. Yes, we do.
Okay, thank you very much. Yeah, and so I'm going to quickly talk to you about how to maximize your mental well-being. And when we say mental health is also part of health. And when we say someone is healthy, right? Health is not just physical, right? Health is four-dimensional: physical, mental, social, and spiritual. Usually, when people say they are unwell, they are talking about their physical well-being. So, for example, someone goes to work and they are likely to go for excuse duty about a physical health problem, right? But if you go to HR, you tell them you are tired, you're worried, you're depressed, they don't see that as health. And so you can't even ask for permission to stay home or go to the hospital for those things. But health is not just physical. There is also mental, there is also spiritual, there is also social. And all these four work together to cause problems. And when it comes holistic healthcare. Holistic healthcare, what it means is that we're using measures in all these four areas to be able to, help a person, maximize their well-being, right? And for a functional adult, for an adult who is able to do well with life, you realize that they have to be healthy in all these four areas. Otherwise, they will not, right? So physical health has to do with the body structure and processes. Mental health deals with how you feel and how you behave, and how that thinking or feelings or behavior is affecting your life. Then social, we talk about your relationships, economic issues and work problems, culture and tradition. Now social media has become an important aspect of social health, because what happens on social media and the internet and stuff like that, it's a major risk factor for a lot of problems. Then spirituality, we talk about your purpose, worldview, connectedness, and also things we do when it comes to our relationship with God and stuff like that, and other deities. Then there's engaged to religion and religious things, right? So for a functional adult, for someone to say, I'm healthy, I am okay, I'm able to work, I'm very, very productive and all those things, it depends on these areas of a person's life, right? And when it comes to health-related issues, spirituality comes up very, very strongly, right? And especially in an environment where religious activities is a part of our lives, things about health is usually, it has this spiritual undertone. And it's okay because spirituality is also part of health. But usually it is the misinterpretation of religious texts that creates the problem, right? So there are people who have a certain mindset about religion and spirituality, and they actually bring that also into their healthcare practices. And sometimes they're a bit narrow-minded and tunnel-minded or tunnel-visioned when it comes to health. But let me throw in a scripture just to explain what I'm saying, that it is really not religion. It is the misinterpretation of religious texts. So for example, a classic scripture, let's say in the Bible, Luke chapter 2, verse 52, it says that, and Jesus grew in wisdom and stature and in favor with God and favor with men. Right. So if you look at even the Bible acknowledges the four-dimensional aspect of health. So this scripture basically says Jesus was healthy. And I think that is why Jesus was very, very, very functional and very, very successful. And the term grow is important because there should be growth in all these areas. So your current ability to be able to do well is not just a product of your adult life. It starts from childhood, right from the womb. Everything that is happening to a child from childhood affects them. And that is what creates the differences amongst adults. At the workplace, you may find different people with different approaches, different aspects of their lives. And when you check, you realize that everything began from childhood. Particularly when it comes to mental health, adverse childhood experiences is so important, right? So your current health status may be as a result of even childhood-related problems. And if you don't look at it carefully, you may not be able to understand why you are going through the things you are going through now, right? And so health is multidimensional. We are very, very, very complex. And we are very, very complex human beings. So if someone comes and they are going through some stuff or they have some diseases, it is four-dimensional. There is no illness on earth that is purely physical or purely mental or purely social or purely spiritual. All these factors work together to create problems. So you realize that if spiritually you're not okay, it affects your physical life, your social life, and mental health. If mentally you're not okay, it affects your physical life, your social life, and spiritual life, and like that. Because all these four, they work together to create problems for the person. So any functional adult, and it doesn't matter who you are, you may be a doctor, a psychologist, or a journalist, or a teacher, your ability to function well is dependent on your health on these four levels. And so if there's something that is not happening well in any of these areas, you realize that it's going to show up. So when it comes to maximizing your health, you must include measures that maximizes your mental well-being, not just your physical well-being. You must include measures that maximizes your social well-being, not just your physical well-being, and also your spiritual well-being. Because if one of these areas is affected, you would have problems. The same way we can measure a person's physical well-being, we can also measure a person's mental well-being to see whether they are mentally healthy or not. Right? So, for example, for physical health, most of the things that you may do at your work is physical well-being driven. So, your annual medical checkup, you go to the hospital, they check your physical well-being and not your mental well-being. So, they do your BP, your pulse, your sugar, they will check your kidney, liver, and those things. Those things are only a measure of your physical well-being. But when it comes to your mental health, there are things that we look at to determine whether mentally you are healthy or not. And these 6 things reflect a person's mental well-being. The first is the person's ability to cope and adjust to life situations. Anybody who is mentally healthy, they are able to cope and adjust to life situations. So if you realize at some point in your life, you are really struggling to cope. You wake up in the morning, it's like you don't want to do anything. You go to work, you realize that day-to-day things is affecting you. You know you're struggling. It means that mentally you are not healthy. Again, if you are mentally healthy, you should be able to form and maintain meaningful relationships. So all relationship issues and dynamics is under mental health. All relationship issues, so spousal relationships, mother, father, daughter, some kind of family relationships at work. There are some people, because they don't have good relationships at work, that alone adds to their problems. And the question is that why is your relationships falling apart? Your ability to navigate your way around relationships is a function of your mental capacity. Then again, too, if you are mentally healthy, you are happy with what you see in the mirror. You have a positive self-perception. So all self-identity problems, identity issues, there are people who don't love themselves until they make up, they don't feel good about themselves. They are changing this, they are changing that. They don't appreciate their own uniqueness, and they are, they are not happy with themselves, and they look down on themselves. They have to do all kinds of things themselves. They compare themselves with other people and all kinds of things. Those things are a sign that the person is not mentally healthy. Then again, to anybody who is mentally healthy, they should be able to contribute meaningfully to society, right? They should be able to contribute meaningfully to society, right? And again, to pursue their life goals. Because if you're mentally healthy, you should be able to dream and achieve those dreams. You should be able to navigate your way around different things and be able to say that this is the dream that I want to achieve and achieve it, right? So issues about career, purpose, confusion about what to do with your life, the fact that you're struggling to meet your goals and stuff, it's a function of your mental well-being. So those who are not mentally healthy realize that they keep struggling with their goals. They keep struggling to do the things that they feel like doing, and that affects them significantly. And again, they struggle to live independently. They realize that anybody who is not mentally healthy, they overly depend on people for physical support, financial support, emotional support, and all kinds of support. They realize that they can't even own their own thoughts. they can't do the things that they feel like they should be doing to be able to live independently, they will struggle. Then finally, if you are mentally healthy, your presence in any social space is positive. You are not the reason for the problems wherever you find yourself. So you realize that all dysfunctional behaviors and the fact that people become destructive and they are not able to do well and contribute meaningfully to society, it means that they have a problem. Come to think about it, you go to a lot of workplaces and we know those who cause the problems at the workplace. Their presence in social space have become destructive. In Ghana, there are people who may even be in certain, job environments, and they are the reason for the problems. You see, they are the reason why the problems are happening. Anybody who is mentally healthy, they actually want things to be fine. They go to work and they're looking at how things are going. They want things to, actually improve. Anytime you realize your presence in any social space has become more destructive, more negative, it means that you're having a problem. And I'm sure for this point, almost everybody in Ghana is likely to have some problem, right? And you look at even politics and everything happening in politics. Why are people destroying the country? Why can't they have a certain kind of positive impact on society? And all these things is a function of a person's mental well-being, right? And so in moving on, like I talked about growth, that we grow physically, mentally too, we must grow. Socially, we must grow. Spiritually too, we must grow. Otherwise, our adult life would be problematic. Otherwise, we cannot be able to function well as adults, because adults are a reflection of their childhood. So right from the womb, you are growing physically, mentally too, you're growing. Your brain is growing. All your neural tubes and connections start in the womb, right? So everything that happens to the mother, whether the mother is unwell or they are taking unprescribed medication or they are having hypertension, diabetes, everything that is happening to the woman is affecting the development of the child and even the mental growth and the capacity of the brain to be able to interact with the environment. During delivery and labor, right? Everything that is happening during delivery and labor is affecting the child. Prolonged labor, birth asphyxia, neonatal jaundice and stuff. A child is born and they cannot cry. The doctors will do and before the child starts crying, right? Permanent brain damage. So there are some kids who are actually destroyed before they are born. And so they are not able to function well mentally because there are problems happening to them in the room around delivery and stuff like that. So physically, you see a child growing in weight, in height, before you realize they are wearing their parents' clothes, right? And they are running around, and physical growth is influenced by the person's gene. When you feed them well, they grow well. When you protect them from diseases, right, they grow well. When they adopt a healthy lifestyle, physically, they will grow well. But mentally, spiritually, there are things that influences the growth. I can't talk about all of them, but these basic things affect a person's mental growth right from the womb. The first is genes. There are mental health problems that has a genetic linkage. And all these neurochemical changes and biological changes, almost all of them have a certain genetic basis or biological basis, right? So someone may have depression and there are some genetic issues with it. So if a mother had depression, they are likely to have depression. The same way, if a mother had hypertension, they are likely to have hypertension. The same way with mental health problems, right? Then the next thing is every information you're giving to a child, right from childhood, everything they are picking around is influencing their mental growth. So in a very toxic home where they are screaming, there are negative words, there are abusive words, and all those things happening to the child, whatever they are watching on TV, online, and stuff like that, is why even reportage and things like that is so important. Every single information a child is picking is influencing how they think, how they feel, and how they behave, their mental well-being. Then again, the things they are observing. So everything we observe in our environment, everything we observe at home, the relationships at home between mother and father and stuff like that, every single thing a child is observing is influencing their mental growth. Then again, every single experience is influencing their mental growth. And the experiences starts right from the time they are born. Breastfeeding, Kids who are not being breastfed well, they are not growing emotionally well, because that interaction with the mother, the baby on the mother, that love, warmth, comfort is affecting the child's emotional and mental growth. Father carrying the child on the shoulders, pacing up and down, playing with the child, is affecting the child's emotional, mental growth, right? And again, to children who are not playing, they are not growing. As they play, they navigate their way through several activities with kids. They grow mentally and socially whilst they play. Children that are not playing, they are not growing. So now even the extra classes system is affecting children's mental growth, right? So you go to school from 8 to 4, you come back to there's an extra classes, no play. At the weekend, extra classes. So cognitively, the IQ may develop, but the SQ, the social intelligence, emotional intelligence, the guy is not growing, because play helps a child grow well, right? So children who are not playing, they are not growing. They are not growing mentally well. Another experience is when a parent abuses a child, whether physical or sexual or verbal abuse or emotional abuse or neglect. All these negative experiences for a child is damaging their child growth. So the person is old, the person is, what do you call it? Is a journalist or a doctor, a psychologist, yet they are damaged. They are professors, yet they are not okay. They are top managers, yet they have a problem, because there was a problem with their growth. And if things are not done well, they go into all kinds of dysfunctional adult behaviors, right? Then again, to parents comparing one child with another child is destroying them. And all those experiences, every negative or adverse childhood experience is affecting a child's growth. Then training, the things we teach them, to say sorry, not to abuse, and all those things affecting a child's growth, right? And so children are growing by the minute. Whilst they are growing physically, we see them grow physically. We see also that they are actually growing mentally, right? And also seasonal things affect a person's mental growth. And I'm sharing this with you because if you are a journalist, know that you are not immune to life situations, and your situation in life can influence your mental well-being and subsequently your work significantly. So depending on your age, your risk factors may be different, and the crisis you are likely to go through may be different. So from birth, B, to death, D, we go through various life situations, and based on the life situations we find ourselves, right, and the stage we find ourselves, that may be responsible for, or the risk factor for, our mental health problems. So before 12 years, the issues is around love and care, the basics of life. If a child doesn't get that, they don't grow well. The moment they hit the teenage years, it's understanding and acceptance. So every teenager will say, my parents don't understand me, my parents do this, my parents are like this and that. Because that phase is a phase for development of their own worldviews, identity, and independence, right? And if anything happens around that issues, it creates unnecessary problems for them, and it carries on to adulthood. Between the age of 19 and 40, typically support relationships and purpose, trying to achieve your goals in life. If it doesn't go well, you go into some crisis. Between 40 and 65 is more of wrapping up, leaving some legacy and establishing things. If things don't go well, it creates its own crisis problem. Then after 65, it's evaluation about the past and also eternity issues. If it doesn't go well, then the mental health issues will continue. So depending on who you are and where you are, and even the stage of life you are in, you realize that you may go into certain problems, and it can affect your work. And if you don't maximize your mental well, your own personal issues, in addition to the corporate issues Dr. Coleman talked about, and you have to develop effective coping strategies. Otherwise, you have problems. And if you are not able to develop effective coping strategies, then it affects your output. So your own personal issues and all the things you are going through as a person, from your home, from your own crisis situation and financial issues and marital problems or relationship issues and all those things, in addition to the corporate issues we've talked about, then you need to cope. And if you are not able to cope well, then it affects your performance. There are two terminologies, absenteeism and presenteeism. Absenteeism means you didn't come to work. Presenteeism means that you are at work, yet you are not effective. And majority of the issues that people go through and affect their performance, you realize that it's on the level of mental health. So if people are not able to cope well with life, it creates all kinds of problems, even for them, right? And so they may go through all kinds of mental health issues. And respectively, when we say mental health, it goes beyond respectively madness, right? So we have all the fear-related issues, then the mood issues like depression, then the psychotic issues is the normal madness-related problems you have, then the stress-related problem Dr. Coleman talked about. Then again, neurodevelopmental issues starts from childhood. So things like autism, where social skills, intelligence, repetitive behaviors, and all kinds of things happen to the child. Then as people age, some brain changes, they may have dementia. So elderly people who get missing and all those things, dementia-related problems. Then personality issues, how people do things, they see the world around them and respond to the world around them. They may have some personality problems. Then all substance use issues, alcohol use problems, marijuana, cocaine, heroin, and all those addictive-related behaviors is also under mental health. Then sexual-related issues, all sexual-related problems and the issues around them is under mental health. Then sleep issues, eating problems, and people cannot control their impulses. And some people still unnecessarily, they cannot control those urges. Then there is no physical health problems without a dimension which is under mental health. So every physical illness you can think about has its own complications, which is a mental health issue. Then the psychosocial issues like abuse, marital issues, and family conflict. Pregnancy is a major door to mental health problems, work-related problems, career, financial. So mental health issues is very, 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 very broad. That if you don't find the right way to cope with those things, you realize that you may suffer unnecessarily. And majority of the things I've talked about so far, people make it a personal issue. They don't make it a health issue. If someone has malaria, they are likely to quickly go to the hospital for help. But if they have things like depression and stuff, they are not likely to go to the hospital straight away. They will try and cope and cope and cope and cope until they are overwhelmed. Then they go to the hospital. But mental health issues are normal, health issues that also require some, professional intervention. Otherwise, people suffer unnecessarily. And at the workplace, we also have to be sensitive to people's mental health issues so that if they also need help, then we can refer them for some help. So all over the world, we have up to about 1.2 billion people with mental health problems. In Ghana, it's about 10 to 15% of the population, right, has mental health related problems. Majority of them may be women. The anxiety problems are more. Depressive issues, come next. Then we have substance use and those things, which is even higher in men than in women. So it's quite extensive. And all these figures are understated. Right? They are understated because majority of the people never report it. They suffer quietly. They never seek help about it. And that really affects them significantly. Right? And so some of the impact, Dr. Coleman has talked about some of them. Let me add, there is pain and distress when you are suffering and mentally your well-being is affected. You go through all kinds of pain. You will struggle to cope with life. You will be a financial burden on others. Every time you are calling someone for help, it would affect your relationship. You cannot be a better parent when you are mentally unwell. It's going to affect your goals. You realize that you set goals, you cannot achieve them. You set career goals, it doesn't work. Financial goals, it doesn't work because mentally you are not healthy. And you cannot be productive. Globally, we lose about $2.5 trillion, on mental health related problems. In Ghana, it's about $5 billion, of GDP is lost because of mental health issues, right? And mental health issues account for about 30% of all loss of absenteeism from work. Mental health issues account for about 30%. It depends on the country, right? Then again, you get involved in crime-related problems and social vices. A lot of people are involved in all kinds of social-related problems and crimes because they are mentally not well. Then again, to increase disease states and death, right? Dr. Coleman talked about stress. Stress is a major risk factor for diseases and other mental health issues. So your diseases will become worse and worse and worse and worse. And finally, you're going to die. So one of the areas you should really focus on to deal with your mental well-being, then suicide-related issues may come up and addictions. A lot of people are using addictive behaviors to cope with all kinds of problems. All these things are there. And if you don't manage it well, you realize that it's going to affect you. Some of the things that would help you deal with your mental well-being, I'm going to share with it quickly, and I'm going to end, right? But always the approach must be holistic. One way does not usually help. You need multiple ways on the level of physical, mental, social, and spiritual interventions to be able to help fix mental health issues. So it should always be holistic. It should be multidisciplinary because multiple people who are professionals may be involved. So the doctors, the psychiatrists, the psychologists, the counselors, and nutritionists, social workers, and all kinds of people may be involved depending on the mental health related problems, right? And usually you need partnership with the person, because if you don't partner with them and you don't agree with them and they don't even agree to whatever is happening or whatever you're doing, interventions you are setting up, it will not work. And usually we consider the context of the person and individualized care. What it means is that everybody is different and their situation is different, and we all respond to things differently. And so we are very, very careful about the person's background when we are intervening or helping the person, right? And when you meet a professional mental health worker, it can be a psychiatrist or psychologist or a counselor or a mental health or someone who have been trained in that area, right? When you meet them, it's not just going to talk. Some people feel that, oh, as for, going to mental health workers, you are just going to sit down and talk. It goes beyond that. Every single situation and what we do. So we go through assessment, subjective assessment and objective assessment. When I mean subjective assessment, they will take you through clinical interviews to understand the situation, the risk factors involved, where it is coming from, for them to make up their mind what is really going on. In the same way, you go to the hospital with the physical health issues, you will meet a doctor, they will talk to you, understand your situation, then they will make a diagnosis. And after the initial diagnosis or preliminary diagnosis, they will say, go to the lab. In mental health also, we also have a lab, in quotes. We have assessments we do to objectively identify your situation and even rate it so that we know how severe it is and be able to help you. So there are psychological tests for everything in mental health. So we also do assessments to be able to help you. Then depending on what we identify, we are going to give you some medications. Sometimes we start off with medications to balance out all the symptoms and help you feel better. Then you may be referred to see a mental health worker, a psychologist or a counselor or someone, to be able to take you through something called psychotherapy. And psychotherapy, there are different types of therapies that we take the patient through in order to help them think, feel, and behave well, right? To be able to deal with the problem that they are going through. Sometimes they don't need medications, only therapy works. Sometimes it's a combination of medications and therapy. Sometimes it's just a psychotherapy. Then in addition to all the things that professionals are doing, there are things that we can teach you as an individual so that you can maximize your mental well-being if you do them on a daily basis. So there are some healthy practices you can do on a daily basis that can influence your mental well-being. I'm going to end with that. Then again, we know the challenges about mental health issues, stigma, because people over-spiritualize mental health problems, and also they don't understand what it is. They stigmatize mental illnesses, right? For example, even in our local movies, when someone goes to do something terribly bad, which is so bad, the punishment or their outcome is a mental illness. And I wonder where that thing came from. Why can't it be hypertension? Why does it have to be a mental illness? So somewhere in our minds, the over-spiritualization of mental disorders, increases stigma and all those things around mental illness. So in a movie, someone does something wrong, the end result is a mental illness. Why can't it be hypertension or diabetes? Why should it always be a mental illness, right? Then financial issues, in terms of accessing care and stuff can also be a problem. Then also negative religious practice and interference, where people don't seek help also from the hospital and they are chained or they are beaten or something happens to them, even in their, whatever religion they believe in. Then sometimes access to healthcare may be a problem. But thankfully now, you can walk into any hospital and ask that you want to speak to a mental health worker, and there's likely someone in that hospital who has been assigned to deal with mental health problems, and even if they don't have, they can refer you to see the appropriate person. Then also governmental policies. And if the policies are okay, we increase access to mental health care and stuff like that. Ghana, we are trying. Generally, we've done well on many levels. A lot of people have worked over the years. And this year, one of the important news is the decriminalization of attempted suicide. It was one of the major, breakthroughs in terms of mental health care in the country, right? So mental health issues are very, very important, and it affects everybody else, right? So how do you maximize your mental well-being? There are some principles that help. The first one has to do with the fact that when things happen to people, an event happens to people, we expect them to feel a certain way and behave a certain way. But the linkage between what happened to them and how they feel is their thinking. If their thinking is rational, their feelings will be good, right? So all irrational way of thinking, we call them cognitive distortions. People magnify things, they catastrophize, they do mental filtering and all kinds of things. So it is not really what happens to people that influences their feelings. It is how they think. Two people may lose a relationship. One person will say, God, why me? Right? All men are the same. All women are the same. They will be single for life. Another person will say, oh, if you have gone away with your big head, go away with your big head. Another person will come. The same event, different way of thinking. At your workplace, some people don't like you, others like you. So the problem is not you. It is about how they think about you, right? If they are thinking about you is good, their feelings towards you will be good. If they are thinking about you is negative, their feelings towards you will be negative. So our thinking is so important in determining how we feel. And if our thinking about ourselves, about others, about the world, about the future, and even about God, if it is negative, you realize that it affects your thinking. It affects how you feel about life, and it will affect your behavior. So if you can have control about your thinking about things, a lot is going to change about you, right? Another principle is that, when something happens to people, we expect they lose a relationship, they are likely to be depressed. So if something happens to people, we expect an outcome. But really, what links an event to an outcome is choices. A person's choice is so important in determining the outcome. So someone can be offended by someone, and the person will just choose to forgive the person, and they'll be fine. They can choose to hold on to the bitterness and hate, and it's going to affect them, right? Someone is on the street today, will be found in the palace the next day. Another person will be in the palace, will be found on the street the next day. And it depends on their choices. And there are a lot of things in mental health that choice is also important. That if people can have, have control over their choices, it's going to affect their outcome significantly. Because people, most of the time, they are products of their choices. And your choices are influenced by your thinking. And your thinking is influenced by the information and experiences you are exposed to. So these things are very, very important, that you can choose a healthier way of living. That is a choice, right? And if you make the healthier a choice about it, it will affect your outcome. There is a 40-year-old man who came to see me. Husband is dead, doesn't want to marry again. Another 68-year-old woman came to see me. She is marrying to a 72-year-old man. It is choice. And there are a lot of things that happen to people, and it is based on their choices. Another thing to ask do with meaning and purpose. Usually, when you understand why things are happening to you that way, and you have a reason for doing what you're doing, and you assign meaning and purpose to the things you're doing, you realize that enduring life becomes things, yet there is a reason why you're doing it, right? So when meaning is attached to some situation, it helps. For example, for me, I went to medical school 7.5 years. Very, very tough. But because I had an end in mind of becoming a medical doctor, it was easier to go through the pain. And some of you are able to endure things at your workplace because you have a meaning to whatever you're doing. So life is never made unbearable by circumstances, but only by lack of meaning or purpose, right? Then again, people endure suffering better when they suffer with meaning, right? And so when people discover meaning and purpose, things become better. Between a stimulus and a response, there is a space. In that space is our power to choose our response. In our response lies our growth and freedom. So choice is so important when it comes to our outcome. Very, very important. But if you can find meaning about everything in your life, you realize that enduring the pain becomes easier, right? And all of us are actually influenced by three things. Our current state is influenced by our past, our present, and our future. Each one of us. Our past and our present and our future is what decides our state at every point in time. The reason why we know we have a past is because we have a memory. You know you have a past because you have memory. Because you can remember. That is why you know there is a past. If for some reason you lose your memory, you can't even associate pain to anything in the past. So some people have an accident, they lose their memory. They can't even remember their spouses or their kids. Every pain in the past, they can't even remember, because we associate whatever we associate with the past based on what we can remember. Again, we know we have a future because there is something we call imagination. So because we can imagine, we know we have a future. Think about it. Memory and imagination, they are all up here. Your memory is up here. Your imagination is up here. So really, your past is not real, but it is true. Your future is not real, but it is true. It is only a product of your imagination, right? The reality is your present, and the things you can control is what is happening to you now. You can't control the past. You can't control the future. And all of them are a product of what is happening up here in your head. Your past is true, yet it is not real because it is a product of your memory. The quality of your memory determines whatever happens to you or whatever you can remember about your past. But the problem is that you cannot control your memory. You cannot control your imaginations. But you can control what you focus on about what you remember or what you imagine. As for memory, it is there. You cannot do away with your memory. You cannot do away with your imagination. But what you focus on about what you remember or what you imagine creates the difference. If you focus too much on the negatives about your past, you will not be happy. You may go into depression. If you focus on the positives about your future, about the past, you realize that you become more fulfilled or happy or thankful. So, for example, two people may have been raised by a stepmom. They all were not fed, they did all the work in the house and that thing like that. One person will focus on the negatives about that experience and be very bitter. Why did she do this to me? Why did my life turn out that way? God, why me? And those things. Another person will say that if it was not for my stepmother, and because I did all the work in the house, now I am resourceful. Now I can save. Now I can know how to cook. So the same experience, the same past, but the focus was different. So when it comes to the past, you need to focus on the positives about the past. You'll be more thankful. And sometimes we are engrossed in all the negative things that has happened to us, forgetting that we have, there is something that we can be thankful for. Then again, too, about the future. If you imagine doom, the negatives about the future, you may be anxious all the time. But if you focus on the positives about the future, you have hope. So someone will say, hey, what will happen next month? I don't have money. How can I pay my children's school fees? What will happen to them? Are they going to be homeless? You are imagining negative things and you are anxious. Another person will say, oh, today there's no money. Tomorrow there will be money. I'm going to work hard. Things are going to get better. You'll be very, very hopeful. And you may not be as anxious as you should be. So when it comes to the past, why not focus on forgiveness? Why not focus on the lessons and even turn the pain into passion? I know someone who almost attempted suicide, died by suicide at age 18. Thankfully, she didn't go ahead with it. Now she has an NGO for suicide prevention. So she's been able to turn the pain into passion. It's one of the ways to deal with the past. Then again, to enjoy the moment instead of anticipating doom and thinking so much about the future that you are living in the future. Enjoy the moment and focus on purpose and hope and learn to be a better person and develop what you think would affect your future and seek help when you need to seek help, right? So some of the self-help skills, let me just put them together. And these are psychological principles and health principles. I've intentionally put scriptures there because of the spirituality mindset that people have. That spirituality is not against science, that affects your health. It is only that affects your health. So there are things that you do that affects you spiritually that you must also think about. And I'm going to end, right? Have a positive mindset and attitude about life. Be very, very positive about life. And, have positive relationship. Any relationship that affects you, you need to throw them away. Again, rest. Rest as much as you can and exercise. Then again, good nutrition. There are two types: eating balanced diet and also eating what you feel like eating that day. Right? Sometimes you feel like eating food, buy food to eat. Because when you eat what you feel like eating that day, it helps you in hobbies and social networking and humor, things that make you laugh and all that. And sometimes when you come home, engage in things that actually, makes you laugh and social networking and stuff, it helps you. And practice this virtue: thankfulness, forgiveness, being content with what you have, and appreciating your own uniqueness instead of wanting to become like someone else. Then learning to say no or delegating responsibilities. Sometimes we make ourselves so important that we think that if we don't do this, something will happen, and we're overburdened. Instead of saying no, we cannot say no. So learn to say no. Then also prayer and meditation help significantly. Then setting realistic goals and about yourself and stuff like that, it helps. Sometimes our goals is what actually affects us. Then we also advise married couples to have sex as often as they can. Because sex actually releases certain beneficial neurochemicals in the body: dopamine, oxytocin, and endorphins. It will help you ease stress and pain. It would give you some and bonding. Is going to help you feel better and all those things. So sex is also very, very beneficial, and we actually encourage married couples to have sex as often as they can. And finally, you need to identify your risk factors and seek help. Seek help as much as possible. My final word too is that of all the things in this world, take care of you. Sometimes we take care of everybody else, forgetting that we need to take care of ourselves. And so invest in personal happiness, personal development. Practice these self-care things I've talked about. Develop effective coping strategies. And anytime you realize you're struggling, please seek help. There are all kinds of professionals and the mental health to help you. Seek help as quickly as possible so that we can help you maximize your mental well-being. So thank you very much for your time. I'm grateful. Thank you.
Thank you very much, Dr. Isaac Newmanata. We certainly enjoyed your part, and we love the practical way you've been able to synchronize your thoughts that you shared with us. Now, we would want to take the last resource person, and I was very sad to know that the last resource person is a Man United fan, when all members of GPA are Liverpool fans. But for now, we'll give him the opportunity because he's the speaker. Dr. Johnny Ando Arthur is a senior lecturer and a community social psychologist. They do a lot of research on suicide, on community life, how media personnel can influence all of us. And we couldn't have selected any resource person better than him to actually dilate on this subject. So Dr. Johnny Ando Arthur, please, all the journalists, media practitioners who are all Liverpool fans are ready to listen to your part. Please, you have our attention.
Good afternoon, colleagues. Let me thank you so much, Mr. President, Dr. Collins Bedu-Agyemang, for this opportunity, right, to have an interaction with our senior brothers and sisters in the media. But let me say that I can never walk alone. I still remain a diehard Liverpool. Only that I'm not using my computer. So sorry about that, right? All right. So I'll be given a task of we having a discussion on suicide reporting and recommended benchmarks I think you agree with me that the media plays a very critical role, especially when it has to do with health promotion, health education. We cannot do without you, the media. You play a very vital role, in re-educating our populace about the issue of health and especially mental health. So I'm going to use some few minutes, 25 roughly, for us to just look at the media in suicide. What is the role of the media in suicide? Indeed, we have World Health Organization that has given us some, benchmarks for reporting on suicide. We will see whether as Ghanaian media men and women, we are actually complying with this or not. Indeed, we have some research to speak to that. And again, what factors also influence suicide reporting in Ghana? I mean, we hear reports of suicide. What is really motivating how these reports, are made? And of course, the way forward. All right, so as far as our interest in media and suicide prevention is concerned, 3 questions really come to mind. And the first question is, does the specific presentation of suicide themes in the media reflect existing attitudes and opinions on suicide in the society? That's the first question. The way we present or we report on suicide, does it reflect the attitudes and opinions we have about the phenomenon in Ghana? Again, does the reporting of suicidal acts or mode of presentation of these acts by the media, does it influence attitudes towards the behavior of suicide, and consequently the occurrence of subsequent suicidal behavior? The way we report on suicide in the media, does it in a way influence attitudes as well as also what, influence the occurrence of suicidal behavior in Ghana? And again, and for me, the most important aspect, can the mass media be used in suicide prevention? Now, let us see what research really has, helped, how research has helped us in answering this question, especially in our part of the world. But before that, let me say that there's something we call copycat suicides. When suicide occurs and we don't report it so well and responsibly, what we have found is that there's what we call suicide clusters or copycat suicide. But 2 general patterns of suicide clusters have been documented. We have point clusters, where irresponsible reports on suicide can lead to temporary increase in suicide within a particular place. So for instance, a suicide is reported in the media and it's not reported well, and within Accra, right, there's what, a temporary increase in suicide following that report. That is what is called point clusters. Then we have mass clusters, where again, irresponsible reports on suicide can actually lead to temporary increase in suicide, right? Across the society. So not only in Accra, Tema, Cape Coast, Kumasi, Koforidua, Daho, it then, kind of increases suicidal cases, across the society. So these are 2 things, that we have identified as far as the patterns of suicide clusters, are concerned. And therefore, it is important that we avert our attention to what we can do to prevent this. All right, so through our studies, we have examined the power of the mass media in suicide epidemics, and we can classify studies of this nature into 3. We have studies that are focusing on the suicide behavior, and here behavior, we are talking about those that are focused on attempt. They are focused on suicide itself and suicide ideation. When we report on suicide, studies are focused only on those suicides that occur. That is what you may call completed suicide that occur. Or studies are also focused on, the frequency of suicide attempt that follow. Other studies are also focused on, how many people even get the thought, the idea of suicide after a report is made. Then we have other group of studies that are also focused on whether reporting on real suicidal cases or reporting on fictional suicidal cases actually have negative or positive impact. And you see in evidence that, in fact, reporting on real suicidal cases really have been found to have greater impact. Notwithstanding that, I will also show you an evidence showing how a fictional report on the suicide also has created what they call contagion in some part of the world. Then again, method of presentation. Whether suicide is being reported in the electronic media, in the print media, in the social media, and their impacts. So all these have been some of the studies that have been done within the area. But to give you an evidence of copycat suicide, in fact, in the suicide literature, there is this phenomenon called the weather effect. The weather effect. This is borrowed from a book written by Johann Wolfgang von Goethe. The title of the book was The Sorrows of Young Werther, published in 1774. This was a fictional story. Interestingly, the story is about a young man called Werther, okay, and his sentimental and hopeless love affair, okay, in which he shoots himself. The story has been reported to have had imitation effects. In fact, we are told that not only did the story lead to about 2,000 suicides in Europe following the report, following when the book was published, but those persons who killed themselves also, adopted the fashion trend of that protagonist, okay, in that book, who killed himself. The way he dressed, blue coat, long brown boots, and yellow trousers. They were seen to have adopted this pattern of dressing that had become a trend. And in no time, they were found, having killed themselves. So this came up with the idea of, or the concept of weather effect, where we are saying that irresponsible report on suicide can actually lead to what? Copycat suicides. And weather effect, this particular weather effect, like I said, from this particular book, is a key case in point of how, media can lead to what? Copycat suicide. That is if we don't report on suicide very well. Indeed, we have meta-analysis that has also been done, okay, showing that effect of either an entertainment or political celebrity suicide story were about 14.3 times more likely to find a copycat effect than a non-celebrity suicide. So when a big man, when a famous person, takes his life or her life, and we report that story, indeed, I know most of us will rush to report because it is really newsworthy. But the interesting thing is that that has 14.3 times, likelihood of leading many people to also do that. Again, suicide based on real as opposed to fictional stories were also found to be 4.03 times more likely, okay, to lead to copycat suicides. Yes, we have that suicide contagion or copycat suicide has been reported in various countries: United States, Austria, Germany, Hungary, Australia, East African countries, and a whole lot of many countries, right, where this phenomenon has been found. Now, what is the likelihood that copycat suicide will occur? We are saying that the way the information is presented with reports situated on the front page of newspapers, and here we are sending out what the print media. When you put the information on the front page, this is likely to happen. When you mention the term suicide in the headline, again, though it's a taboo topic, we also see it as newsworthy. Sometimes we will sensationalize it. When you put it in the headline, it is likely to lead to copycat, suicide. Then sometimes to outline in the specific details, okay, of the suicide. We have been hearing, how people report suicide, especially on the electronic media. Sometimes you don't know what is the motivation, but as a medium that is supposed to inform, to educate, and to entertain, I think that depending on whatever story, we must know where to put the priority as to whether we have to entertain or we have to educate. But sometimes we just give too much details. The reason why providing too much details may create a problem is that there are quite a lot of vulnerable people in the society. They may have been contemplating suicide. They may have no idea how to go about it. And so when you give graphic details, specific details, what you are doing is that you are giving them the armament. You are reinforcing that, you are guiding them, giving them the practical, steps as to how to carry it. It is for this reason that we do not have to give these specific details when we report. Now, the suicide method used, it is of no effect, as far as education is concerned. When you provide a means of the suicide, the person has taken his life, her life, fine. You don't go ahead giving details of exactly how he did it. And of course, sometimes to showing the photograph of the victim. All these can likely lead to copycat suicide. But my brothers and sisters, in as much all these may be negatives of what? Of irresponsible suicide reporting, not all media depictions of suicide lead to copycat suicide. Indeed, we have also found that, you know, reporting on suicide and doing it so well can actually lead to positive coping. And this is what is called Papageno effect within the suicide research and suicide prevention, field, Papageno effect. So we have weather effects where reporting of suicide can likely lead to what? Copycat suicides. And we have Papageno effect where reporting suicide responsibility can provide people with coping skills. But why Papageno effect? Again, this particular term also, came from the work of Mozart's opera. The title was Magic Flute. It was based on a suicide protective impact of a media. So again, in that particular work, a certain gentleman, had an unrequited love and wanted to kill himself, right? And fortunately, 3 boys came to his rescue, provided him with options that enabled him to cope. And so based on that, that term has been used to describe the media's positive role, right, in reducing suicide, and it's also to providing people, options for, deriving coping, right, whenever they go through suicidal crisis. Yeah, so let's take it this way, that the media can be a double-edged, play a double-edged role. It can play the weather effect. It can have a weather effect that is leading to copycat suicide, more suicides, or the media can also, help us to have Papageno effect, where the media can provide people with with alternatives for coping instead of what? Suicide. Again, evidence has been shown by some, researchers across the world that indeed we have Papageno effects and we have a weather effect. So it's because of all these reasons that the WHO has actually documented a resource for media professionals all over the world. Indeed, it was updated in 2017, and this year it has been updated. And we're expecting that media men, media women will all apprise themselves with some of the key benchmarks, recommendations, just so they will be guided, right, in their report of suicide. So let's look at a quick, let's look quickly at do's and don'ts as provided by the WHO's guideline. So we are saying that do provide accurate information about where to seek help. When you publish on suicide, it is important and it's incumbent upon you to also provide accurate information about where to seek help, because a lot more people, when they read a story, they may find themselves in similar conditions, and therefore your story can help them seek options, seek avenues for help seeking, right? Again, we must also use the story to educate the public about the facts of suicide and suicide prevention. Please let us do well to, distinguish facts, of suicide from myth of suicide. There's quite a lot of myth. Human beings, naturally, we are all sense makers. We make sense. We are people who interpret. Whenever interpretation has to be done, in a context where there is no information, people are likely to provide their own information to help them interpret. And so that is what gives rise to myth. So let us surprise ourselves with what? With a fact of suicide, just so when we are publishing on them, we can provide the facts and separate them from the myth. Again, do report stories of how to cope with life stresses or suicidal thoughts and how to get help. Like I mentioned, when we are reporting, it's important that we also provide people how to cope, how to also to have help. And that's why we are all working together as stakeholders. Yes, so we can always engage as Ghana Psychological Association, so that we can all help in fact, shaping the story such that the story really can have a Papageno effect. Again, do apply particular caution when reporting celebrity suicides. Let us apply caution when you want to do that. Obviously, reporting on celebrity suicides will really sell. It will sell. It is newsworthy. But let us balance our ethics as far as, and then our ethics and commercialization, sensationalism. Let us balance it so well and ensure that at least we help society. Again, let's apply caution when interviewing bereaved families or friends. The phenomenon, where we always rush to the bereaved family to grant interview, right, to find out what happened when this has happened. Indeed, sometimes it really goes against our very ethics as professionals and also as humans. These are people who have gone through double agony. They've not just lost somebody, through this very, crude, strange, and very painful way, but they've also have gone through the torture of having to find out why did it happen. Did I contribute something? Sometimes some of them are even living in guilt because they felt they may have done something to prevent it, but they couldn't do. So when we rush and we go to them and they're already grieving, and we also force them to talk, sometimes we indeed accentuate their pain. And I will provide you an evidence of what somebody said when news people rushed to her to, grant interview. Again, let us also recognize that media professionals yourselves, you may be affected by the stories that you publish on suicides. And my colleagues, Dr. Newman, Arthur, and Dr. Coleman have done an eloquent work, brilliant work on that. We are also human beings. We also have our own needs, and therefore we can also have secondary traumatization. Sometimes the story itself can be so traumatic that we may be affected. So let us also self-care. And a lot has been shared this morning. Let us have self-care. Please, it's important to take care of yourself first, just so you can have the mind to be able to do your work and do it responsibly. How about the don'ts? Please, I've said quite a few. Don't play stories about suicide prominently, and don't unduly repeat such stories. Don't use language which sensationalizes or normalizes suicide or present it as a constructive solution to problem. We have a role to play here. Don't explicitly describe the methods used. It is not important. Don't provide details about the site and location where the person actually engaged in the act. And of course, let us check our sensational headlines. Let us check our sensational headlines, and please use headlines that are broad educated, not headlines that are just overly sensational. And then don't use photographs, video, footage, or social media links where people can actually see the picture of the person. It's very important, very, very important. Sometimes when we do this, we also leave reader comments, and people just sometimes, comment on the stories. Sometimes the comment that people even give is not so helpful, even to the bereaved. So it's important that once you want to publish, just publish, but make it more, likely to be able to help others rather find help, right? So I think these are things that is not beyond our reach to do. We can all do this if we are committed to this. So my colleagues, and I decided to find out whether media men in Ghana have been following or have been, adhering to this guideline. It is the WHO's wish that media men all over the world will adhere to these guidelines. So we did this study to find whether in Ghana we are adhering to the guidelines or not. So what we did was that we sampled 288 news reports drawn from public and then privately owned media, right? And from the reports, we had 261 suicide stories, 7 suicide attempt stories, and then 20 homicide suicides, right? And of the 261 completed suicides, we had 13 celebrity suicides in Ghana. Now let's look at the results. Generally, we found that most of the included news reports failed to comply with the WHO guidelines. Sorry about my spelling mistake here. They failed to comply with the WHO guideline. Now see, 82.6% of the stories, they included the term suicide in the headline. 79.9% included the word commit suicide. Commit, the word C, commit. Please, as we are trying to up our knowledge in these matters, we need to also go with the community agreed guidelines. That as media, we don't use committed suicide. What we commit is something that is offensive, something that is criminal, something that is sinful. Now, the general agreement from WHO and all over the world is that suicide is a life crisis. Suicide is a health crisis. It needs what? It needs to be cared for. It needs to be what? To be treated. It doesn't need to be what? Punished, right? And so if you say commit suicide, then of course you still put it within, right, the rubric of what? Of sin, of a crime. And thankfully, 28th of March this year, we woke up to the good news that suicide is no longer a crime. We are still waiting for the presidential assent. And so even in Ghana, at least, it is not a crime. And therefore, WHO says we should not use the word commit. And 79.9, despite these guidelines, are still using commit. 92.7 mention specific method in violation of WHO's guideline. 66.3 provided detailed descriptions of the methods used for the acts. 92.7 mentioned the specific place or location where the act took place. 83.7 reported the names of the victims. They reported the names of the victims. Colleagues, I believe sometimes when you engage with your colleagues in other parts of the world, I think that you can have a discussion on them, on how they also do it. In fact, in some places, it's a crime for you, a media person, to be doing all this. In fact, they can even lose your license. In no way, they don't joke with this. If you go against any of these guidelines, you may lose your license because society expects you to help in preventing suicide. Yes. So 55.6 included the photos of the victims, in their suicide. And then 50.3 provided reader-generated comment threads. So they provided comment section where people were also just saying and writing whatever they like, with no regard for the bereaved family, right? So surprisingly, each of the 288 news reports analyzed failed to mention any of the potential helpful features recommended by the WHO. At least where to get education, where to get the help, education on suicide, providing facts on suicide, mention a suicide prevention program or support service. None of them in the 288 news reports did it. So what can we say? We have a long way to go. We have a long way to go. And that's why I thank GPA and I thank Ghana Journalists Association for giving us this opportunity for us to at least, know what we got to do. All right. Now, so we decided to also find what influenced, the way we publish suicide stories in Ghana. And some colleagues of mine led that research, and we've sought to find news editors' views about suicide and suicide stories in Ghana and what really motivates the stories, how they present the stories. We found 4 main reasons. One is deterrence. For most of them, the stories are presented in a lesson can be learned is when the issue is brought out in the media and then discussions are generated in society and everyone condemns the acts. We also found another motivation that is called didactism, right? The consideration that I think it is one, the human element, the newsworthiness. Let's put it out there, the newsworthiness first. It should be newsworthy, right? So here, the idea of it being newsworthy was a key motivation. So it is news, and what is newsworthy is what we watch, what will sell. Okay, so that was also one motivation. Then, of course, the issue of celebritism. Celebritism, yes. Somebody said this, to quote, naturally, there is a saying that when you bleed, it sells. Bad news sells better than good news, and such as suicide. In fact, human beings will want to hear more bad news than good news. When they hear bad news, everybody is rushing to buy bad news. We also had a few of them who committed to ethics, right? And one said, you see, before you publish anything like that, at least the person's face should be covered. There are certain ethics that people don't even know that are in GJE, Code of Ethics. There are certainly things you can't do. So here, you also found a few people who were publishing and were committed to professional ethics. So my dear friends, my dear colleagues, what is the motivation driving the way we present our success stories? Our motivations, found in any of these 4 that I've just said, or maybe you also have your own motivation on how you do it, which we're not able to capture in this our research. All right, so now let me present this story, then I end. Right, so someone lost the son, and it created a very big problem for her. The son killed himself, and the circumstances surrounding it was so, unfortunate. So a radio station called her, and they wanted an interview. And this is what she told me when I actually, interviewed her about her experiences so far. And this is what she said. I quote, "A radio station called and they wanted to put me on air. I said, what? What did they take me for? Do they think I'm a child? I refused. How is that possible? You can't be in your studio and tell me what to do." I told them everything is okay, and I was not prepared to grant the interviews. If you want to do your job well, you ought to come down to me. You sit there and want things freely for your news. That was not possible at all. My brother, so Alice, the little respect we can give, the little cultural sensitivity we can show is that even in normal death, we are enjoined as community members, cultural members, at least to follow some rules, non-rules, right, of grief and all that, bereavement. And so somebody has lost, a son, through this means. Somebody has lost a relation through this means. The person is already worried, and we are in our station, and we are calling the person, just grant interviews. What is the motivation? Is it the newsworthiness? Is it the welfare, right, of the person who is bereaved? So I think this is an evidence that indeed most of the people that we talk to, when these things happen, sometimes they go through a lot and they don't like it that way. Maybe we can give them some time to grieve and then go negotiate a time that will be very convenient for them, go commiserate with them, and then maybe if they feel okay, it's stable, then we can go ahead with our interview. I think it's important that as humans and as social professionals, we stick to human ethics, and at the same time to subscribe and adhere strictly to our professional ethics. So what is the way forward? Media in suicide prevention. We have seen through this my presentation that the media can play a significant role in either enhancing or weakening suicide prevention efforts. By enhancing it, it means that we need to adhere to agreed guidelines as spelled out by WHO. Again, we also need to be sensitive to our culture and see what culture even enjoins us to do when people are bereaved or when people die, right? We can also weaken suicide prevention efforts when we fail to adhere to all this. Now, our reports may minimize the risk of copycat suicides. Our report can also increase the risk, right? So we may provide useful information about suicide, right? And help, reduce misinformation that normally comes up, when suicide happens. So we all have this responsibility. And let me end by saying that WHO for the past 3 years have decided to maintain the theme for World Suicide Prevention Day. That is what? Creating hope through action. Creating hope through action. People who are suicidal are persons who are going through a lot of crisis. That is making them unable to see options, unable to see hope. Our duty is to help them and then use our stories more or less to create hope for them and also let them see options available for seeking help. Thank you so much for your audience.
Thank you very much, Dr. Johnny Ando Arthur. We certainly enjoyed your insight. We have learned a lot. How we report on suicide, some details that we need not include because of the possibility of copycat syndrome. Then we enjoyed how you were able to connect the dots with your research inputs. Certainly, that is what we expect from academicals like yourself. Your ability to blend your research outputs so that you'll be able to generate knowledge to support industry. Dr. Joniando, we appreciate your commitment. We thank you, Dr. Isaac Newman Arthur. We thank you, Dr. Richmond Akwa Coleman. Now, maybe you have a burning question. We have just about 5 minutes. You may have a burning question that you want to ask. Kindly just use the raise hand button and then we will give you the opportunity. Please, we are asking the administrator for the Ghana Psychological Association to leave the GPA's contact, as well as the email. For those of you who need a recording, we will send it to you once you request it from the administrator. So kindly, Henry, kindly put the GPA email and the phone number with your name. We ask all of you who will need the recording, perhaps you need follow-up input and explanation, you will need help yourself, you will need assistance for someone, you will need support for your organization so that your organization will be able to develop a mental health policy that support every journalist and every media practitioner. Please, you can contact Henry through the email and the phone number that is going to be shared in the chat feature. Please, at this point, if you have a question, raise your hand. We see Solo's hand. Please, Master Solo, kindly unmute and go ahead.
All right, thank you so much. I want to congratulate the team and then also the association. I also want to thank our facilitator for the insights. I recently reported on an attempted suicide case, which
Unfortunately, Elder Solo, it appears where you are, your network is unstable. If you can reposition yourself so we can hear you clearly. Okay, let's take Ramat Bashiru, and then we'll come back to Elder Solo. Bashiru, kindly unmute yourself and go ahead. Bashiru, please go on. All right, it appears we cannot hear Bashiru. Maybe if there is another question. Joshua, please go ahead and ask your question. Joshua.
Okay, thank you. Thank you very much. Can you hear me?
Yes, we hear you clearly.
Okay, so Dr. Johnny, thank you very much. I think this is an eye-opener, very insightful, but I would really, really appreciate it if you can share a standard sample report of how people are reporting this suicide, because for somebody who is not how do I put it? Somebody who really does not
or
a psychologist. Exactly. It's difficult for you to tell a journalist that report something and don't mention the method, don't mention the place, because those are the rudiments of journalistic reporting. So can Doc share with us a standard or a sample of a report that as it were, would meet the WHO approved standards?
Okay, thank you very much, Joshua. Dr. Johnny Ando, I guess you are still here. Please.
Thank you so much, my brother. Yes, I think that this is a very important question you have asked. I mean, you don't just give the guidelines when there is no sample to learn from. So what I will do is that I will work with my president and GP and then share with you, I mean, some of these manuals and some of the stories that we have also seen as being good stories and stories we have seen as going outside the guidelines. Yes, so you can be guided. Yes, you can be guided. Right. Thank you so much.
Thank you. Thank you very much. Thank you very much. So we will do that as you take the details, the email and the WhatsApp number of the administrator. We will add all those manuals just to support your media practitioners. Yes, Elder Solo, kindly unmute now, and we hope to hear you this time around. Kindly go ahead and unmute.
All right, so thank you so much. Sorry for the bad night that I have. Yeah, so what I was trying to say is that I reported on a case where a lady attempted to kill herself because the father threatened to sack her from the house just because she
So sorry. Maybe we'll recommend Elder Solo. You can type your question in the chat box within the next 2 minutes, and then we can address your concern. I don't see any other hand. Elder Solo, you can also call the GPA number, and we can also respond to you directly. So I want to thank all of you. Okay, we see Muniru in Wa. Muniru, please, you can ask your question. Go ahead and unmute Muniru.
All right, thank you very much, Doug. Really refreshing to be part of this short workshop. I say short workshop because this workshop should have taken us the entire day. Doug, can you hear me?
Yes, I hear you clearly. I'm just admiring the
Doug, can you hear me?
Yes, Muniru, we hear you clearly.
Yes. So, Doug, I was really very happy when you made mention of reporting on suicide without using pictures of the person and also even describing how suicide is committed. I had that argument with somebody on radio some time ago where the person was describing how the suicide took place. And I said, please, I'm not interested in that. Because the more you do that, it means that you are teaching the next person seated how to go and commit that same suicide. Because there are 1,000+ people out there who are just looking for the opportunity to take their lives. And I particularly have been somebody who went closer to depression before. And I know the languages that you hear when you are closer to things like this. When you are in that mood, the only convenient way is a negative way that comes to your mind. Anything positive is far away from your mind. You only accept and agree on the negative things. And so it is important that we as media personalities, we adhere to some of these rules, say that you report. Somebody might say that, so what are you reporting on? It might not be. I'm giving you an information. The picture doesn't matter. And I've also even gone to indicate that we should look for ways of not even indicating with pictures. For example, you see somebody reporting on suicide, the person using a rope. The rope is tied, a very big one, to indicate that if you want to kill yourself, look for a big rope like this. Somebody wants to report on a murder, and the person using a sharp knife. And when you see the knife, you really love it, and you want to taste it. Yeah, use any other thing that would be the future image and give the information about the suicide. I don't think that there will be something wrong. So I only just want to comment the organizers of the workshop that you really spoke what I wanted to hear. What I wanted to hear is what you have come to confirm, and I'm really happy about that. Thank you.
Thank you very much, Muniru, for that commendation. And certainly, we are very much ready to collaborate with all of you so that we can continue to promote the mental health and well-being of Ghanaians. We will give the opportunity to Issa to ask his question. Issa, please go on.
Yeah, the issue of media, most of the time we tend to place it at the doorstep of just journalists, but we have movie producers in Ghana, locally and internationally. And most of these things you talk about is in the how someone commits suicide, the processes, what even the person goes through. So my question is, what is GPA doing about it to broaden this whole discussion about the media and suicide generally? Yeah.
Right. Okay. I'm sure Dr. Johnny Ando will come in on that, what GPA are doing. Let me take Martha's question, and Dr. Johnny Ando, you can comment on Muniru and Issa's point, and then we will add to that. So Martha, please go ahead and ask your question, Martha. It looks as if Martha has unmuted, but unfortunately we cannot hear her. Ramat, please, you can unmute now. We hope to hear you this time around. Okay. Ramat too, we are not hearing it. Dr. Johnny Ando, I guess you can go ahead and offer your comments and then.
Right. Thank you so much, Doc. And thank you, my brother Muniru, and I think the other brother, I didn't get the name. Yes, in fact, concerning your, I'm very happy that you sharing what we have discussed. It's a lot of things happening, but I'm happy that you are very committed to also leading that effort, within your association, to ensuring that a few of your colleagues will adhere to that. But you see, the problem is also sometimes not the reporters. We may have a reporter here who may have gone through all this and maybe so much sensitive, right? In reporting suicide. But who will take the decision on what story must go out there? The editor. And so we have had a series of workshops. I think I've seen Auntie Peggy and a few senior journalists here. We have actually done this before with them. And these reporters come and tell us that, you see, we wanted to do all that what we have been taught, all that we have learned, but our editors will take the final decision on what to go out there. It is for that reason that we did this study, to see what informed the news editors and the stories they put it out there. So I think we need to also broaden the discussion, as my brother has also said. We need a lot more of news editors, in such workshops. And I think that GPA, maybe we need to also sometimes go to them. They've been, showing so much, commitment to this by always coming for our workshops. I think that if it means we going to them, and in their boardroom, we sit down with them and Jojo and see how best we can really, put it strongly. I think we've got to do it. Yes, and concerning the issue of expanding the scope, okay, of target population for this kind of workshops, it's important. In fact, what we are even getting a lot more of these, irresponsible, suicide reportage on the bloggers, okay, on the blogs and in movies. You watch movie and you see a whole scene, sometimes 5 good minutes, where a movie director is just trying to show to the whole world how this man, is trying to actualize an idea to want to die, the methods he has to go for, and even the process of ending up. 5 minutes, people are watching. So these are people who are also very important in this effort. And thankfully, we have put a proposal together, right, where we are seeking some grant to be able to do a research and see what the trend is, have empirical basis on what is happening on those media as well, and how best we can design an intervention to help them and the work they do. Thank you.
Thank you very much, Dr. Johnny and Arthur. We appreciate your insight. So Muniru and Isa, I must say, as an association, we are doing our best. A number of times we have collaborated with GJA, especially when my dear former president Afomoni was there to do an engagement session like this. This year, together with GIBA, we have organized this. Together with GJA, we have organized this. We continue to connect with all of you, and we are ever ready. If any media house would want to invite us to offer some of these engagement sessions, we are ever ready to do so. Now, given the question you ask, a guide and all that, we are going to work together with the facilitators for this session, Dr. Andor, Newman, and Coleman. Will come out with at least a succinct 2-page document, and we will circulate to all media houses. We will circulate to all those doing the behind the scenes work, the editors, the media owners themselves, and what have you, so that this can serve as a succinct guide regarding mental health reporting and especially suicide. Perhaps this should be a succinct outcome of this engagement session so that we can continue to support ourselves. Let's give the last opportunity to Ramat again, whether we'll hear her. Ramat, please go ahead. Ramat Bashiru. I don't know whether it's a her or she, him. Right. We still can't hear Bashiru. So, colleagues, I would want to offer the closing remarks. As the president of Ghana Psychological Association, we strongly believe that the role journalists and media practitioners are playing are very crucial to our life and to the peace and sustainability of Ghana as a country. We have a lot to do as far as grooming these media personalities and these experienced media men and women who put their lives on the line to be able to report on what is happening around Ghana. What I would want to say is that there are some urgent actions we need to take. Foremost, as individual media personalities, we want to take our own lives into our hands. We have a role to play at the individual level to ensure that we prioritize our well-being. We need to invest in our own well-being by making sure that periodically we assess ourselves, we seek help where necessary, and we connect with those who matter so we can get the necessary help and support that we need. Second, I charge all the employers, all the media houses, we need to build and develop a mental health policy. We must provide mental health and psychological support to all media colleagues. I have done 4-year research among media personalities and media practitioners. It is sad to say that a lot of the famous media practitioners we have are suffering from one form of mental health condition and the other. In our research, we even found some who contemplated suicide years ago. And from our own research, we also got to know that media practice, and especially the profession of journalism, is the least paid. It's one of the least paid professions in Ghana. For me, that can certainly induce them into financial distress, and that can worsen their mental health state. I charge all media practitioners, I charge all employers, all media houses to indeed prioritize the working conditions, especially psychosocial care, of all media practitioners under their care. I would want to hear that this media house is now providing psychological support to help all those who may be going through post-traumatic stress disorder, to help all those who may be experiencing emotional labor as a result of their work. This is something that will warm the hearts of all mental health practitioners and all psychologists in Ghana. The third note that I want to sound is Ghana Journalists Association must take the lead in supporting all its members. If for nothing at all, they should strengthen the collaboration with mental health related bodies so that we can support all our practitioners within the space. Now, the fourth thing that I will say, the various training institutions. Now, almost every profession have integrated mental health as part of the curriculum that support the trainees. In medical practice, we have introduced it. In nursing, we have it. Allied health, we have it. Business schools, we have it. Why not media? And for that matter, training of journalists. I think it's about time we take a second look at the curriculum that we are using in training the future journalists and media practitioners. We have contemporary challenges, and that require that we adopt contemporary approaches to addressing the needs of journalists and, for that matter, media practitioners. We all have a role to play. I urge you all psychologists, mental health practitioners, please reach out to these media practitioners and let's help them. It is not all the time they will call us. Even if they call us, we want to ensure they are fine, they are doing well. If they are not well, what the pen will write, what they will say in front of the microphone can throw the peace and unity of this country into a serious situation that will not support all of us. So may we all continue supporting our media practitioners and our journalists. And I am confident we'll have a healthy media industry that will support all Ghanaians to our success. So we thank you all, GIBA executives, especially my dear sister, Gloria Kiaji. We thank you, my brother, Albert Jumfo, and the entire leadership team, and all media houses that joined. I am sure, given all of you are here, you will write a thing or two about what we have discussed. Make sure you highlight the fact that I am charging all the employers to care for you. If you put it that way, the editor will write it because it's not coming from you. Do not be afraid. Go out there and share as we have all discussed here. And I'm sure all of us will benefit in one way or the other. So thank you all very much. May God bless you. The Psychology Week has not ended. Tomorrow is the annual general meeting for all practitioners and friends at the University of Ghana Kofi Drama Conference Hall, just close to the Department of Psychology. On Saturday, we all want to meet at Ebri so that we support all those who are exercising with some flyers and awareness campaign. After that, we will meet at one of the joints so that we can enjoy some kinky party. We invite you all to be there so you join the psychologists and their friends for this kinky party as well. May God be with all of you and do have a nice business day. Bye-bye. My name is Dr. Collins Bedu Ajman, President of the Ghana Psychological Association. It's been a pleasure having all of you. Bye-bye. Bye to everyone. Bye.
Bye. Bye.
Bye.
God bless you.
Bye. Bye. God bless
Bye-bye,
you.
everyone.
Bye.
God bless you so much.
Bye.
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 Thank you.
Bye-bye.
We go.